Hello, YouTube world, friends, family, viewers, and subscribers. And I want to give a special thanks to the new group of subscribers that has been coming onto my channel. I think I've picked up about 250 of them, and I think it's just constantly growing. I want to thank you all. It's been a blessing. I've been trying to work on new things to try to get this channel to blossom. So I thank you. I will not disappoint. However, I also want to give a disclaimer, a quick disclaimer. I'm not going to say all of it, but you can go to my description box and look at it and read it. But here it is. The content on my channel is provided for support, general information only, for your edification. It's about learning. I'm a lifelong learner. So that's my thing. I love learning. But I also want my subscriber base to learn with me. Not only that, remember, this is not a substitute for going to get professional medical advice, diagnosis, or treatment. So remember, you run into some issues with anything medical or psychological, please go to the right genre, whether it's a medical doctor or a psychiatrist or a clinician, mental health expert. Go to these people and ask for help. Okay? Read that disclaimer. Now let's move on. Today we're going to talk about kind of three things, but we're going to focus on one. We're going to talk about ADD, we're going to talk about ADHD, and we're going to talk a little about autism. So what I want you to understand, all three of these may have similarities, but they are different diagnoses, and they are different disorders. So, in spite of the similarities, let's learn. Let's talk about the ADHD in retrospect, in respect of all respect, and we're going to add the others as we go. Definition. I compiled this definition because I want to edify. Let's talk about ADHD. What is it? It is a neurodevelopmental condition identified by patterns of inattention or daydream state, finding it hard to concentrate. The young person may be hyperactive, so you're looking at hyperactivity, sometimes feeling restless and struggling with sitting still. Not only that, the impulsiveness that this disorder brings to your body and your mind is like you're doing one thing, all of a sudden your brain shifts and you're ready to go do something that haven't finished what you were doing already, but you're going. Sometimes you say things or do things without even thinking about the consequences first. Some children are just more restless or excitable than others. And then we talk about these little rambunctious boys that got a ball of energy in them. You can't shut them down. You can't switch them off. They just go like the Energizer bunny. They all over the place. But that doesn't mean they have ADHD or ADD. Okay? So, others may have these inability to function in multiple settings. So that type of impairment may be a reason to look into, hey, what's going on with my kid? And then you have another group of neurodevelopmental disorders, including autism and dyslexia. Just one example. Okay? So don't think that you're on your own, or you're lone strangers or rangers or whatever you want to call it. Hey, you're not. So let's talk about the difference between an autistic child and a child with ADHD. I'm just going to focus on the differences right now. And then we're going to move on to something else, a history more or less. So now let's look at the differences. Individuals with ADHD typically have difficulties sustaining attention. They have hyperactivity and impulsivity. They may be easily distracted, forgetful, and struggle with being still. They lose focus very easily. And so this is one of the things that you must think about when you're trying to flip and toggle between ADHD and autism. Now, for an autistic child, they may have hyper focus, which means sometimes they don't want to let nothing go. They can be focused on something, and you want to try to get them to change focus or shift to something else. You wrestle a bear. You're going to wrestle a bear. They are hyper focused. They get onto something, they stay on it, they don't let go. Okay? So that's one of the things there with being hyper focused for autistic children on a specific interest. But they also often exhibit difficulties with social communication, have trouble with their social skills, social dynamics, and repetitive behaviors. Some behaviors that they just keep doing. It's always coming back. And they're doing it over and over again. And you try to snap them out of it, but guess what? It's difficult. They may have a narrow range of interests and may be highly sensitive to sensitive stimuli. So you have the sensitive sensory stimuli. They have trouble with them because sometimes it can be too much for them. Okay? Now, where did all this ADD and ADHD start? Where did it come from? Well, it wasn't always called ADHD and it wasn't always called ADD. Going back to the 18th century, moving up to the 19th century, to the 1960s, behavior-like situations, they were misunderstood. Today we would call them attention deficit hyperactivity disorder, but back then they was like, this is a lapse in moral control. Or they would say, this is a character flaw, or this is a defect, character defect. It wasn't until the American Psychiatric Association officially first recognized attention deficit disorder, that's ADD. And that was in the 1980s. After years of clinical observation and involving terminology, as terminology changed and got better, over the years they moved towards AD, and then they put the hyperactivity in disorder. So now you have the ADHD. And it reflects changes and views on the mental disorder, particularly in children around the year of 1987. ADHD became its official diagnostic term. Okay? So, when we think about children, and I'm talking about children ranging from the age of 5 maybe all the way up to 19. We will also learn that boys was more likely to be diagnosed with ADHD than girls. And it was 2 times more, sometimes 3 times more. 2 to 3 times more diagnoses fell on boys than the girls. For every 2 to 3 boys, 1 girl is diagnosed with ADHD. So what should parents do? I mean, how would parents handle these things? So, well, what parents need to do, when they find out that their child is struggling, it's time to go see someone. This is not saying that your child is sick, something wrong with your child, blah, blah, blah. Don't get caught up in all of that. What you want is answers. So when you do go and sit down with a professional, they may ask questions. And these questions may be like, what challenges are they experiencing? He or she. What type of challenge? Is it attention span? Or is it hyper focus? Or is it the lack of focus? Is it hyperactivity? They're going to ask these type of questions. Then they're going to say, how significant is these challenges? Is it happening twice a week? Is it happening 3 times? Is it happening every day? So you're going to get those questions, and then another one is like, what situation settings is these things happening, these trials and obstacles your child is dealing with? Is it happening at home? Only at home? Or is it happening in the school system and at home? Can your child go to church with you and sit in church and not after you tell your child, hey, don't be cutting up everything. But then the child says, keep cutting up. So they're going to want to know the areas, the environments, and all that. ADHD does not diminish with age. The older you get, you still got it. Once you're diagnosed with it, and if it's truly those symptoms are there, they will stay there. Now what changes is as older you get, do you have the coping skills to deal with it? So that's where the parents and the professionals come in, working together to put together the coping skills, the mechanisms that you can use to help your child function as normal as possible. They don't evaporate like steam coming from a steam engine. It's there with you. What about people that feel like, hey, I feel like it's just me. I feel like I'm the only one that has a kid like this. Here's what I say about that. Number one, if you go online and look for support groups, you will find it. And you'll find out you're not the only parent that's dealing with that. Number two, you have to realize that the child did not ask to come. Okay? And the child did not ask for that disorder. And there are many more children and adults suffering from ADHD. So let's think about those numbers. Let's roll out some statistics. Think about this. In a high school setting, and I'm using hypothetical numbers, in a high school setting, there's about 5 to 10% of students that may have ADHD that projects the same type of symptoms that can negatively affect their grades. Now, when I give a total number, I'm going to say 1,000. So let's say this high school, and we're talking about from freshmen to seniors, and we have 1,000 students. You're talking about anywhere from 50 to 100 students will be diagnosed or may be diagnosed with ADHD or came into that school already diagnosed with ADHD. Keep those numbers in mind. Now, here's some estimates that I kind of did my due diligence to research on, and I'm pulling it from maybe 2016 all the way up to 2020. Didn't go past 2020. So, an estimated of 2.4 million children ranging the age of 6 to 11 have been diagnosed with ADHD. 2.4 million people. Think about it. That's a lot. We're talking about ages 6 to 11. Let's move to the next one. An estimated 3.3 million in the U.S. Talking about in the U.S. Right now, U.S. United States of America. Let me make that clear. Children ages in the range of 12 to 17 years have been diagnosed with ADHD. That's 3.3. My family, my friends, my subscribers. Think about that. Now we're going to go beyond the United States. Approximately 129 million children and adolescents worldwide has been diagnosed ranging from the age 5 to 19 years old with ADHD. I hope y'all getting these numbers, because you're not the lone ranger as a mother or a father of a child. Okay? You're not the lone ranger if you're a person with ADHD. Approximately 129 million children and adolescents worldwide between the ages of 5 to 19 years old have been diagnosed with ADHD. Okay? Here's another one. More than 366 million adults worldwide have been diagnosed with ADHD as of 2020. That's where I stop my statistics. Because if those numbers alone is not good enough for you, you go find someone. Go find them. Pretty easy. Just do research. And I'm going to say this too. Not all children on their first diagnosis of ADHD truly have ADHD. Sometimes it is something different like dyslexia or autism. Do your due diligence, please. Go have this kid evaluated to double check. If you get a diagnosis from one, do a second opinion. I am telling you, get yourself a second opinion, because some kids just may have trouble learning. Think about a kid that has anxiety being in a room full of people and can't learn that way. That child don't have ADHD. That's an anxiety disorder. And being in that classroom suffocates that child, makes that child feel like, oh my God, OMG. I know people today, y'all, that cannot ride on a bus. In Gainesville, cannot ride on the bus system because of their anxiety disorder. Okay? So, do your due diligence, get a second opinion. Moving on. According to the Center for Disease Control, once a diagnosis is given and your loved one should be at that time guided towards what? Learning information. You want to provide, and you want the medical institution, wherever you took that child, psychiatric institution, doesn't matter. You want them to say, hey, here's some packets, information packets on ADHD. Here's some support groups, a list of support groups you can reach out to. Blah, blah, just give it to you. You want that. If they don't offer it, you ask. Plain and simple. But this is about your child growth and development. Okay? A diagnosis of ADHD may appear to be unfavorable. However, you can begin to enhance you and your child's comprehension level of the symptoms. Identify and capitalize on your child's strengths and learn their weaknesses as well so that you can get with the therapist and y'all can develop coping skills, coping strategies. And that professional will help you develop a treatment plan and days for therapy. So, all of this stuff go hand in hand. Don't think that you can do one without the other. Okay? Because your child gonna need, it's gonna take a village, so to speak. Your child gonna need you, your husband. That's the mother and the father. They don't need to be in no house with all this racket going. I'm gonna get to that. Schools and workplace, when we're talking about older children, like high schools, places like that, workplaces, like people that beyond college, now they're in their workplace, they're doing that, but they have ADHD. These are places, that are legally obligated to make reasonable accommodations to accommodate people with disabilities, including ADHD. So if you're working a job and you have ADHD, you have issues, oh yes, it'll be to your benefit to take advantages of those reasonable accommodations. Okay? Now there's some adjustment the parents have to make. So this don't let you off the hook. You have to make some reasonable adjustment. First of all, as a parent, you need to learn to be understanding, because this is not going to go away. And this is not something that you can yell and scream at them and it's going to go away. This is not something that you can bring the church folks over and they're going to pray and, exercise some type of demon. And don't misunderstand me. I'm not saying that God will not do what he wants to do, but let him do that. On the other hand, you need to focus on doing the right things for your child. You need to be understanding and you need to be patient, because in that growth and development stage, learning stages, you're going to run it, or she's going to run into some brick walls many times. They're going to get frustrated, and you need to be right there to say it's going to be all right. Okay? Setting realistic goals for you men that have young boys and you want to turn him into a Peyton Manning or one of these other Kobe Bryant or something. You best to be realistic about your child's abilities and disorder. Because you can push that child too hard until that child will be afraid of failing because how it feels and how you react. You got to learn how to set realistic goals for those children with ADHD and then go through the process with them. Let them know, okay, we're not going to do too much right now. Let's see if you can get this done first. And then when they do, you celebrate. And then you set another goal. And then if they fail, if they don't quite hit the mark, you be there to say, it's okay. All of us do that sometimes. We don't get everything, or we don't make it every time we try. Let's try it again. You want to be there to teach that young person about life. Creating a balanced lifestyle for your child to thrive in. You grown folks, with your petty differences, you got to let that go. Because your child with ADHD, and even if it's autism or dyslexia, they don't need to live in a house that's a war zone between mom and dad, because dad wants his way and mom wants her way. And you just got a lot of yelling and screaming. That kid, an ADHD child and an autism, they already have a war going on right up there. Trust and believe. There's a lot of confusion going on up there. So they don't need a house that is a war zone. So get that mess balanced. Aiding a child when they wrong, you still correct this child. Don't aid in the bed foolishness. You can still correct your child when they're wrong. But it's not what you do, that's how you do it. Now let's talk about nutritional value. I think about LeBron James, how he started a school in Ohio, and one thing he did, he made breakfast and lunches free for all children. Because the child cannot go in that classroom with their hunger taken care of, it's hard to concentrate on the matter at hand. So food and their diet is important. Eating good, eating right is paramount. Let's get that fixed. And teaching them self-management skills. I cannot stress enough how good it is for you to take an autistic child and just walk him through what you do when you clean his room up. And you show him, this is how you pick this up, this is where you put this, here's the dirty clothes basket, here's this, here's that, this is where you put your shoes. Because that is training the brain. And they need that self-management skill. You're teaching them self-care. How to take care of themselves. Simple things like, let's brush your teeth, let's do this, let's do that. Everybody know the little things that you do at home growing up. These are the things you want to teach that child. Because the more that they have some type of regimen of where they're doing something at a certain time, it helps build focus. So with that being said, that's what you need to know to get started on learning more about ADHD and realizing that an autistic child and a child with ADHD have two different problems. Okay? Remember, go see your doctors, go see your PCP, go see your therapist, go see whoever you need to take this child to get the ball rolling. You can always go online, look up things. Videos is fine too, but you're not there for diagnosis, people. Just remember that. My name is Robbie Reeves, and I'm the founder of the Critical Cognitive Progressive Thinking channel, and I thank you all for joining me on this lesson on ADHD. And I would like to say, God bless.